I have not been able to work since the spring of 2011. And it was the spring of 2012 when I went on Social Security disability. There is a waiting period before you get Medicare. And in that waiting period, you just don't have insurance unless you can buy private insurance. And my experience with that, it was completely out of my reach. It just wasn't an option. So during that time, my care and treatment was very limited. And this is a big issue for me because I feel like if I had had access to the care and treatment that I needed, I would not have had the disease progression that I have had, which in the end is just cost more money. I couldn't find options. I live in a small town. I travel 3 hours to go to my care providers now. My primary care provider is the only one that is local to me. I did the best I could with him and paying cash on occasion, the same with pain management. But it was inadequate. There's no way I could have ever afforded advanced treatments for rheumatoid arthritis. For me, the process started with Plaquenil, which not terribly expensive, could pay cash. Methotrexate is the same. Depending on a patient's financial situation, those two things are probably the most accessible. Also, non-steroidal anti-inflammatory drugs, which was the early part of my treatment as well. But there's no way I could have done specialty care. Could not have seen a rheumatologist. We at the time didn't even have a rheumatologist here. But the fact that I had to pay cash out of pocket really limited me personally. And I know that there are other people that have a similar experience that deal with trying to have care without insurance or in gaps without insurance. This waiting period for rheumatoid arthritis patients who go on disability, this waiting period for Medicare compromises a lot of us. Some people are able to pay cash out of pocket for care, but in my experience, the vast majority aren't. And this really limits access to treatment. In my area, there is a community care clinic where you can get care, but you're not seeing specialists here. I can't see rheumatology and cardiology and all these things, and I most certainly would not have access to biologic treatments. I mean, these are thousands of dollars a month if you were to pay out of pocket. And that's assuming that I could pay for all the lab work and exams and rheumatology visits. It's just not, it wasn't happening. It wasn't feasible. I desperately needed a third hip surgery at the time that I had to wait for because I didn't have insurance. This left me almost bedridden, but there was nothing I could do but wait. And, even for patients who have private insurance, I'm talking about Medicare personally because that's my own, but patients with private insurance, I hear all the time about the difficulty in accessing, care and the proper medication. So for those without insurance, I mean, I could almost characterize it as impossible. You're just not going to get the care that you need because, the care that's, subsidized or provided free can typically only go so far. And that's just visits. You're looking at, even if you use the cheapest medications that are available, but what if they don't work for those patients? Or what if the patient's intolerant to it? But you got to look at labs, x-rays, MRIs, other specialist visits. I mean, you just can't, I can't imagine. And, that was early in my disease when I had that gap, but that early time is where the intervention is really the most needed. And, it's unfortunate that people face this battle. And, the reality is economics is part of this disease. And, there's a lot of solutions out there on the table, but, it's a big deal for most patients. And not having insurance just adds to the psychological and emotional stress of the disease. It's hard to deal with.